name's Lane. I'm a student in PE at UAMS. I'm going to be doing a quick neuro assessment on you today. It's going to be a series of tests, so we'll just have to take each one as it comes, okay? We're going to start by testing your sharp versus dull. So I'm going to be having you close your eyes and just tell me whatever extremity I'm touching and whether it's sharp or dull. Okay. You can just relax on either side.
Sharp right arm, dull right arm, sharp left arm, dull left arm.
Sorry.
Dull right leg, sharp right leg, sharp left leg, and dull left leg.
Okay. Patient is able to determine the difference between sharpness and dullness in all of her extremities. Now we're going to be doing the same sort of situation, except we're doing hot and cold, okay? So I'll have you close your eyes, relax, and just tell me what extremity and what temperature you feel. This is a hot pack, and then just like a metal tuning fork.
Right arm hot, right arm cold, left arm cold, warm, sorry. Left arm cold, left leg cold, left leg hot, right leg cold, right leg hot.
Okay. Patient is able to determine the difference between hot and cold sensations in all extremities. Okay, now we're going to be doing the same sort of thing as we were before, but I'm using a Q-tip, just testing your light touch, and I'm going to do all your extremities and then also your face. So just tell me where you're feeling it.
Okay. Right arm, right leg, left arm, face, left leg.
Good job. Patient is able to determine light touch in all of her extremities as well. Next, we are going to take this tuning fork. I'm going to have you close your eyes, relax your hands, and I'm going to be putting it on all 4 of your nail beds. I just want you to tell me if you feel vibration, pressure, and then which extremity you feel it on.
Okay.
With your eyes closed.
Right middle vibration, left pointer vibration, left big toe vibration, and right big toe vibration.
Perfect. Patient was able to determine the location of the tuning fork in all 4 extremities, therefore her vibration sensation's intact. Now we are going to, I'm gonna sit down so I'm kind of eye level with it. I'm gonna take each foot and I'm just gonna rotate your toe up and down. I want you to tell me whenever I land, whether it's up or down with your eyes closed.
Okay. Down. Up.
Okay. Patient is able to determine whether her big toe is up or down bilaterally, therefore her position sensation is intact as well. Okay? Just a couple more tests in this regard. What I'm going to do is I'm going to have you hold your palms out like this. I'm going to write a number, and then I want you to tell me what the number is, and then I want you to keep your eyes closed. I'm going to put an object in there, and I want you to tell me what the object is. Okay.
3. 3.
Okay.
A coin.
Perfect. Patient is able to identify the number 3 in the palm of her hands bilaterally, and she's also able to identify a commonplace object like a coin. Therefore, her sternosis and graphesthesis is intact. Now, Caribbean, what we're going to have you do is I'm going to have you just repeat some movements after me. Okay? Now I want you to go like this. And do like one at a time, like kind of, there you go. Now I want you to just do while your feet like that, okay? Patient's rapid alternating movement is intact in all 4 extremities. Now I'm going to have you take your left pointer finger and I want you to touch where my finger goes. Okay, now I want you to touch your nose and then touch my finger. Okay, do it one more time. Now I want you to close your eyes and then touch my finger where you think it is. Okay? Now I want you to do the same thing. We're going to do the same sort of exercises on this hand. Nose to finger. Okay? Now I want you to close your eyes and put the finger where you think my finger is. Okay? Now I want you to lay back. Sit fine. No, you're fine. And then I want you to take your left ankle and then drag it down your shin. Now I want you to do the other side. Okay? And you can sit back up. Point-to-point movements are intact, including finger to finger, finger to nose, and heel to shin bilaterally. Now what I'm gonna have you do is, and I'll do it with you, is stand up without using your hands. Okay, now I want you to do maybe like 3 or 4 little bounces. Okay, now I want you to bend at your knees. Did you have any pain, stiffness, tenderness, or anything like that? Okay, patient was able to stand up without using her hands from a sitting position. She was able to perform several hops, and she was able to bend at her knees slightly without any pain or tenderness as a result. Now we're gonna do test your gait. So I'm gonna have you walk across. So I'm gonna have you start over there. I'd like you to just walk normally across. Okay, now turn around and I want you to walk heel toe in a straight line. Now I want you to walk on the balls of your heels, balls of your feet, and then walk on your heels. Okay, I'll have you come stand back here. Her gait had a normal base. She did not have any balance problems, so her balance was intact, and she didn't have any arms swinging with any of her walking movements. Now I'm gonna have you put your feet together and close your eyes. Okay, can you open them up real quick? And I'm gonna have you hold your arms out like this. Close your eyes, I'm gonna press on them, okay? Okay, you can open your eyes and you can sit back down. Okay, patient had a negative Romberg and a negative pronator drift test. Now I'm gonna be testing your reflexes. So I'm gonna be using this reflex hammer throughout. Just have you relax this arm down first, and then I'll do the other. Okay, we'll lift, have it hang. Okay, I'm gonna come to your other side. Breath. Okay. +2 reflexes in her brachioradialis, which is her C5, C6, her bicep, which is C5, C6, and her tricep, which is C6, C7, and that's bilaterally. Now here again, I'm gonna move to your lower extremities and test those reflexes as well. So I'm gonna start with your patellar. Oh, I probably should have you scooch back a little bit and have your legs hanging so we can see it a little bit better. Sorry. Okay. Then I'm gonna move to your ankle. So just hold your foot and then hit your knees. Down hers. Okay. She had +2 reflexes in her patellar, which is her L1, L2, L3. No, L2, L3, L4 bilaterally, and then her ankle is S1, and that was bilateral as well. Now I'm gonna have you lay on your back, okay? And I'm just gonna drag this across the bottom of your foot. Okay, that response is present bilaterally. Next, I'm going to just test your ankles. So I'm gonna have them swing around and stuff, and then I'm gonna push them straight, okay? Good job. Okay, no ankle clonus is present bilaterally as well. Okay, thank you.